Hello everyone, welcome to another episode of FYI. We are pleased to have with us today Dr. Chakravarthy A K. He's a nephrologist at Apollo Speciality Hospitals in Nellore. Thank you for making time out of your busy schedule for us, sir. We are so delighted to have you with us today.
Same here as well. Thank you.
Today, we will be getting some of the most common COVID myths cleared by Doctor. So, sir, I will start with my first question.
Yeah.
A common symptom of COVID is that you lose your sense of taste and smell when you're infected. Does this happen to everyone, sir?
Yeah. See, so this is one of the very common and it's a sort of atypical symptom which you don't see routinely with other common cold virus. So in fact, you suspect corona if someone has loss of taste and smell, which is not seen in other virus. So in fact, they have seen almost 80% of the people who are infected with the COVID virus, they develop this symptom. And majority of them, they recover, but some people, they don't recover actually, but it's very small percentage, but majority of them do recover after say 4 to 6 weeks.
All right, sir. So the next question, only older people and those with underlying health conditions get complications. Is this true, sir?
Not exactly, because this was something more often seen in the first wave, but in second wave, we are seeing more actually young people. In fact, so people say between the 30s or early 40s, without any comorbidities, we are losing them actually. So it's not the same what it was used to be in the first wave, where we used to see more elderly people and people with comorbidity dying. But still, if you take the number of people dying, definitely it's the older people who are dying. But saying that this particular wave, we are seeing quite a significant number of people, young people actually dying without any comorbidities.
Yes, sir. So does COVID transmit through air?
Yeah, it is. Actually, it is proven now. In fact, it can transmit in 4 different ways. The commonest and the most commonest way is actually through a droplet infection. Like if someone sneezes or someone coughs, you have small tiny droplets which remains in the air. And if you sort of breathe the opposite person, say if he is within 6 feet distance, and if he breathes that air droplets, then he can get infected. That is the commonest one. But now it is proven air to air. That means if someone say coughs or breathes and leaves the room, that virus can still hang in the air for 3 hours. That means it is air to airborne. That is the other route which people, researchers have put. In fact, that is one of the reasons why it has spread across the globe. So that is the second route. And the third route is through the surface contact. Like if someone with a coronavirus coughs and because the virus can actually be alive on the surface like plastic or steel for 2 to 3 days. So which means if someone with coronavirus touches that and you go and touch it later, like a doorknob or something, then you can actually get it. So that's why people insist on hand wash. And one more route is through the stool actually, like you have a contaminated bathroom. So that is, there are 4 different ways. But now air to air one is something which has been recently proven. It spreads through air. Yeah.
Okay, sir. So there are a lot of home remedies that get spread around to help against COVID. So do these home remedies and vitamins and supplements help?
See, for you to say someone helps, you need a proper scientific analysis. Like you should do a trial and then you should say like you should compare 2 different groups, someone who has taken and who has not taken. But definitely there are no trials about these home remedies and vitamin C. But one thing I can tell you is there's nothing wrong, as because most of them are not toxic. So there's nothing wrong if you take them, but at the same time, I suggest, there's no proof that they will work.
Yes, sir. So when we buy things from outside, is it necessary to sanitize everything we buy?
Yes, that's what I was trying to impress you. Like one of the ways, routes, how it can spread is through the surface contact. So it's very important to always say something like if you are trying to vegetables, what I'll suggest is to just soak them in salt water before use them. And other non-essential things, don't use them for at least 48 to 72 hours because the virus can stay on them for at least 72 hours. So just keep them in a room And after 72 hours, then you can start using them. Otherwise, if you have to use anything before that, better sanitize and use it.
All right, so another common doubt that everyone has is that vaccines usually take long years to make, and the COVID vaccine was made in such a short duration. So how safe is this vaccine?
See, this COVID vaccine, I mean, probably in the entire history of vaccine manufacturing, this is the only vaccine which was manufactured in such a short time. So because it's a matter of emergency, you have to save as many lives as possible. So obviously, you can't expect 100% safety and quality in these products because they're done on an emergency basis. So if you are asked a concern, because most of the safety concerns are actually started coming after they were released into the market. For example, the vaccine which you have recently, like your Covishield, the one which AstraZeneca has made, they initially they started using it after the trials, and then in the post-marketing surveillance, they found that it is causing some blood clots, which they started warning, and some of the countries they banned it. But it's a very rare complication. Like in India, we are continuing to use it because we don't have any other vaccine actually. So most of these vaccines, if you are asking me, are they 100% safe? Definitely no one can prove it because we have to wait and see. And if you ask me, are they 100% efficacious? No, is the answer again, because the only vaccines which they claim is at least the Pfizer one and the Moderna one, they are claiming an efficacy of 95%. Whereas the vaccines which are available in India, the Covishield and the Covaxin, they're somewhere between 75 to 80%. That is a claim. And one thing you have to remember is these people who are vaccinated, they can still spread the virus. It's not that they can stop because uh, especially they can have some mild infections. Once you take the vaccine, these people who have the vaccine, it's like, for example, let us say if someone says it is 80% efficacious, that means if you vaccinate 100 people, 80 people may not get the disease and only 20 people can still get the disease. But this disease is supposed to be a mild disease, and most of these people, they don't die. That's what they claim. And the second thing is they don't need hospitalization. But in our own experience, what we are seeing in the ground level, it's actually not true. What we are seeing in the hospitals, because again, this data will come at a later stage. We are seeing people who are getting vaccinated who are dying after receiving both doses, but it's definitely a small number. It's not a huge number. It's definitely a very small number. And at the same time, we are seeing people who got vaccination developing complications like needing hospitalizations. But still, if you ask whether you have to take a vaccine, yes, definitely the chance wise, if you are vaccinated, the chance wise for you to get hospitalization or dying is very, very small compared to people who are not vaccinated.
Yes, sir. So out of the vaccines that are being circulated in India, which is the most effective? And should people be worried about which vaccine they're getting?
No, see, as I told, both vaccines have their own benefits and they have their own problems. So the important thing is whichever vaccine is available, go for it. Don't say that I want this vaccine or I want this vaccine. As I said, the Covishield, the claim is around 75%, and the Covaxin, the claim it is around 81%. But you have to understand Covishield is studied more extensively across the globe, whereas Covaxin was released even before they finished the phase 3 trials. So in that way, I think both are almost safe. You can use them whichever is available. But now, soon in next week, I think we'll be getting the Sputnik vaccine as well, the one which was the Russian vaccine, where they in fact they claim 91% efficacious. And they're coming with one more, because most of the vaccines which are given in the world, whether you call it Pfizer, Moderna, or Covishield, any of these vaccines, they are supposed to receive 2 shots. So, but whereas the one with Russian vaccine, which they call Sputnik Light, so they say you can just have one vaccine, one dose of vaccine, and they claim it is 80% efficacious. Coming to the regular Sputnik, which you have to take 2 doses, where they claim 91%. And the only other vaccine, which is a single shot vaccine available in the world, is coming from Johnson Johnson. So only these 2 vaccines, Sputnik Light and Johnson are 1 dose vaccines. Whereas all the other vaccines, they are 2 dose vaccines. And for my side, you don't have to wait. Whichever is available, you take. There's nothing called one is better than the other.
All right, sir. So if you get the first dose, how long do you have to wait to get the second dose? And after a certain time, does the efficacy wear off?
See, that is something, again, ongoing, based on ongoing, because no one is, the initial, all the vaccines when they were used in the trial, for example, the Oxford vaccine as well, the Covishield, uh, they used a gap of 4 weeks. But now they claim that you can use it actually after 6 to 8 weeks, the second dose, which they earlier used for 4 weeks. Whereas the Covaxin, the still you have to supposed to get the second dose after 4 weeks. So suppose if you miss the Covishield, as I told, so that means suppose if you take Covishield today and you can have the second dose after 6 to 8 weeks. Whereas the Covaxin, you are supposed to take it after 4 weeks. And even a delay of 2 weeks is okay, but generally if you delay it more than 2 weeks, at least what they suspect, it's not a proven, what they suspect is the efficacy of the second dose may not be as good. But again, it doesn't mean you have to go for the full vaccine schedule. So that is a gray area where people still don't know. That is the correct answer actually. But try to take the vaccine, the second dose, as far as possible on time. But maximum gap you can give is probably 1 or 2 weeks delay.
Okay, sir. So now there's double mutation and even a triple mutated variant that was found in India.
Yeah.
So are these vaccines effective against these mutants?
Yes, yes. Yeah, at least what people claim now is that all the vaccines, in fact, it's not our own vaccines, all the vaccines which are available across the globe, they're working against all the mutant strains.
All right, sir. So when should someone that is COVID positive get admitted?
See, what you have to understand is, you have to understand, suppose if 100 people get COVID, 97 people, they can just stay at home and they can just manage at home. You don't need hospitalization. It's only 3 people out of 100 actually who can develop complications and they have to go to the hospital. So the best treatment for COVID is still home quarantine and paracetamol, nothing else. All the other things, what they claim, in fact, there are a lot of medicines you can see in the prescriptions like the ivermectin, doxycycline, azithromycin. None of them are proven drugs against COVID. In fact, we have seen a lot of people who just stay at home and they take paracetamol, they just settle down. But one thing they have to do is, suppose what you have to do is the important thing is COVID, you have to understand how it actually causes the problem. It's not the virus actually which actually kills you, it's the how your body reacts which kills you, okay? So when, like people, once they have the symptoms, they have to note the day. Day one is you have to count it as the onset of symptoms on the day when you have fever, cold, cough, count it as day one. And then just keep monitoring every day. Most of the people, whoever develop complications, they develop between day 7 to day 12 from the onset of symptoms. That's when you actually develop the complications. So what you have to do is, suppose if you have symptoms, then you get tested, and then you have proven COVID, then you just isolate yourself. That's the most important. Just isolate yourself from everyone at home. And in fact, you should all the contacts, previous contacts for the last 2 days before you have the onset of symptoms, they also should be isolated and they have to be monitored at least for 5 days, because most of the people whoever develop symptoms, once they get the virus, usually it happens anywhere between 5 to 10 days. So all those people who you had contact 2 days before you had the onset of symptoms also should be informed that you had COVID and make sure they are isolated and they keep monitoring. And then what you have to do at home is just take rest. That's very important. Never try to do exercise and all those stuff. You can do some breathing exercise, but don't do anything physical activity or going to a gym or doing heavy exercise. Just keep drinking a lot of fluids, have a healthy diet, and then buy one pulse oximeter. That is very important for the management of COVID. You know, it's very easily available in the market. So just get one pulse oximeter, which is available anywhere between 1,500 to 2,500 rupees in the market, and then keep monitoring oxygen regularly, especially from day 5. So if your oxygen levels are coming down below 93, that is a time when you have to get alarm. Like if you are, then definitely you have to immediately contact your doctor, and anything below 90, yes, you have to go and get admitted into hospital. But as I told you, this happens only in 3 out of 100 people. Remaining 97 people, it just remains normal. And once after 10 days, you get the onset of symptoms, you are definitely, most of the people are not infected. That means You self-isolate for 10 days, and from say, probably you can take another 3 or 4 days. So if you isolate yourself for 2 weeks, then without even doing the COVID test, you can just go out and you can mix with the society. So that is how it has to be managed. But unfortunately, what is happening is people, if you have power and money, if you just develop, once you approve COVID, they just go and sit in the hospital. And that is actually blocking the beds for people who actually need hospitalization. I think that is something we have to educate everyone. It is completely treatable disease. It's very important is you have to pick it up early and go to get the treatment at the right time.
Yes, sir. So now for my last question, what is the most effective way to wear a mask?
See, mask, you have to understand there are different types of masks. None of the masks actually, whatever we are wearing, the so-called surgical masks which are available in the market, they prevent the COVID because virus is, the particle is even smaller compared to the pores which you have between the mask. So the ideal one, which probably is the best one, is the N95 mask, which you must be seeing, the N95 mask, which you have to make sure you cover the nose, your mouth, and there should not be any gap between the nose and the mouth. You have to cover it completely. And but saying that, it's a bit expensive and it's not easily available. So the next best one is wearing a double mask. So you wear one mask, the regularly available mask in the market, and you put one more when you're going out. So one thing is definitely proven is wearing mask cut down infection significantly. So I think it's definitely recommended, and it is something 100, no doubt, 100% proven. It has cut down the transmission in the community.
Yes, sir. Thank you, sir. This was such a wonderful talk. Thank you for making time for us, sir.
Sure. Thank you. All the best, ma. Thank you. Take care.
Thank
Bye.
you, sir.